Once upon a time, in the African forest, there lived a king, King Simba, known for his team who is good at repairing watches. Excuse me, Mr. Lion.
Hi, how are you?
I'm the messenger from Zumba.
Okay.
I got my lord's watch. I tried in repairing this watch all over the world. I cannot fix this watch. I heard that you guys are good in fixing watches. Can you please have a look at this watch? And can you please fix this?
Of course. So, shall I have the watch? Give me 5 minutes. I will fix it for you. Don't worry.
Are you sure? I
yeah.
tried all over the world.
Yeah, trust me. I will fix it for you.
Okay, my king.
Okay.
Okay, my king.
Okay then. Hi guys, we have work for you.
Not gonna fix my watch. I know well. You guys are not gonna fix my watch. Ho 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 ho. I know. Mr. Messenger, monkey, I got your watch fixed. Here is your watch. Here is your watch. Oh my God, Mr. King, did you fix my watch? Is this the watch I tried to repair all over the world? Oh my God, what a team! What a team! Can I have a look at your team, please? Can I have a word with your amazing team, please? Please. Okay, Mr. Monkey. I will give you a chance to talk with my team. Mr. King, I'm really scared to meet all your lions. I'm scared to see all your lions who are working as mechanic for you. Please, Mr. King. Guys, out from work. We got a customer.
Yes, my lord.
Mr. Monkey, do you want to have some word with our team? Yes, my lord. That'll be great if I have some word with your teammates. Guys, do you want to talk to the monkey messenger?
Yes, my lord. It's our pleasure.
Hello guys, I'm the monkey from the east. I'm really surprised to see your teamwork and your leader and how much he trusts you guys. Can you please tell me more about your leader and your teamwork success?
Hi, Mr. Monkey. Yes, our leader has many good qualities a good leader should be having, such as adaptability.
Good judgment.
He trusts us.
He's a good motivator.
He is confident.
He's competent.
He has good communication skills.
Good interpersonal skills.
He is willing to take the right risks.
He has the ability to make difficult decisions.
Yes, he also has some other qualities a transformational leader should be having. Hi friends, we have a case scenario in which we have shown qualities of a transformational leader. So, let's watch this scenario.
Miss Janet is a 43-year-old diabetic, hypertensive, admitted to the hospital with history of severe abdominal pain for the past 2 weeks. He has undergone his basic blood works and that reveal elevated counts. Her scans reveal suspected malignancy and she has undergone total hysterectomy, and following the hysterectomy she has been admitted to the ICU for complaints of severe fever and suspected sepsis. The blood culture showed gram-positive staphylococcus and she is on broad-spectrum antibiotics. Her MRSA sample has been sent and the cultures reveal MRSA positive. Steve is a fresh grad taking her for the first time in the morning shift. This is the first time he is taking care of an MRSA client. Let's imply the 5 practices of leadership in this case scenario. Hello guys, I'm Steve. I'm a fresh grad. I'm going to take care of her. This is the first time I'm taking care of an
Steve is not removing his watch, I guess. And he is using his personal telescope. Oh, he is seeing the hand trap, but not using that. Oh. Oh, gloves first. Gloves. Watch in his hand. Then he is putting the gown. Then the mask. Look at the way he is messing up our encryption control protocols. Lastly, the glasses. Once I can see the board sign. He is entering the patient room.
Hello, Janet. I'm Fibin Sebastian. I'm a nurse for you today. Can I have your ID, please? Okay. Here, Janet. Perfect. Can I have your date of birth, please? Okay. Awesome. Okay. How are you today? Doing good? Okay. Can I have look at your breath sounds, please?
He is using the personal telescope to examine the
Can I please take off your
MRSA
gloves?
positive patient.
Okay. I would like you to take nice deep breaths for me, please. Okay, thank you. I'm going to turn it from here. I'm going to do the other side, please. Nice deep breaths for me, please. Okay. Do you want to throw up? Throw up. She's going to throw up.
He is going to throwing up, so just helping the client.
Okay. Okay. Do you want to do that? Okay. Do you want me to write baby? Okay. Okay. I'm gonna go see your chart for any PRN medication. Okay.
Now Steve is going out to check the PR medication, but he is wearing He's not removing his gowns, not removing his personal equipments. So now he is coming with a PRN medication with the same gown and gloves that he put earlier.
Jerone, I got your PRN drugs for you. Can I have your ID, please? Perfect. Photo ID, please. Making sure that you're not. Okay. Like to have your drugs. If you would like to have some water. Okay. Child is gonna take a big while. Okay. I'm gonna go come back. Okay. Right.
And now Steve is coming out of the room. So scope, remote. He's removing the mask first. He's contaminated himself. He's at risk for infection. Now the glasses. Then he remove the gown. Lastly, the gloves. Again, look at the way he's messing up our infection control practices, and he's still looking the hand rub, but he's not using that. Hello, Steve.
Okay.
I'm Jerone Jose. I'm the chart nurse.
Okay. Yeah. How are you?
Good. Actually, I would like to talk with you for 10 minutes.
Okay. Okay.
I told Kathy to take care of your
Yeah.
patients.
Oh, sure.
So would you please mind stepping into my office
Okay.
for
Sure.
a second?
Sure. Okay. Okay. Thank you.
Thank
so
you.
much. See you there.
Hi, Steve. How are you?
Hey, Jerone. I'm doing good. How are you?
Good. Thank you. So please take your seat.
Oh, okay. Thank you. Thank you, Jerone. Thank you so much.
Yeah. How is your work going on today?
You know what? Like today's my first day. I've taken care of an MRSA patient. Like, I know like a bit of infection control. How my lectures at school. Like, I think I done a pretty good job. Like, I'm okay. Thanks for asking.
Yeah. How did you feel like taking care of an MRS patient today?
Oh, that was challenging. That was really that's challenging. You know.
Yeah.
But I think that went well. Yeah.
Hope you know you have to make sure some of the infection control practices to prevent
Yeah.
infection to the other clients as well as yourself.
Okay. Like I was a bit tensed, you know what? I was a
I know
bit
you're
tense. My first client, I was a bit tense.
Yeah.
But I think I don't know.
Yeah. Did you feel anything you went wrong today? Any of the practices?
I'm not sure. Maybe I might. I'm not sure. Okay.
Yeah. Actually, I call you. I need to discuss with you some of the infection control practices.
Okay.
Hope
Okay.
you know our hospital vision is 0 infection and 100.
Yeah, I have those classes in my orientation day. Yeah.
I hope you know you have enough knowledge regarding the infection
Yeah.
control practices.
Okay. Okay.
But I feel like
Did they mess up things? Like.
not everywhere, but you have to improve.
Oh,
your
I need
skills.
improvement.
Yeah.
Okay. Okay.
I know you have the
Thanks.
knowledge, but you have to implement
Okay.
it
Okay.
properly.
Okay. Thanks for letting me know, John.
Yeah. You know, leadership is not about personality; it's about a behavior. So, as a nurse leader, here I am going to implement the 5 practice of leadership, and I want to teach Steve to become a successful RN. So here you have seen how the Steve messed up the things, and you know about the importance of MRC positive. It's a contact precaution. Then all the nurses must know the proper way of wearing the personal protective equipment, and they have to. Here, first I am implementing the first practice like model the way. In this MRSA positive, as I mentioned earlier, it's a contact precaution, and because if the nurse don't know how to take care of MRSA positive patient, they may contaminate themselves, other clients, as well as the environment. So it is better to get enough knowledge as well as skills to implement the proper use of infection control practices. Here, I would like to give an opportunity to Mr. Steve to shadow a infection control nurse, so will get a more knowledge how the take care of MRC positive clients, so he can become a perfect R. The second practice of leadership is inspire a shared vision. Then first requirement of a hospital is should do the sick no harm. We are not working alone. The healthcare system comprises doctors, pharmacists, occupational therapists, physiotherapists, nurses, both RN and RPNs, as well as the PSW. So all must have a shared vision to make 0% transmission of infection in a hospital. So if you are implementing our infection control practice properly, so we can achieve our target. The third practice of leadership is the challenge of the process. As we all know, we are in the era of superbugs, which are not controlled by use of antibiotics, but can be prevented or stopped by use of proper infection control guidelines and practices. So Steve, you have to take initiative to prevent infection in our hospital, and you can act as a role model for your colleagues like RPN and PSW. The fourth practice of leadership is enable others to act. Steve, you are a RN. I trust your knowledge and skills, but I suggest you to go for get more knowledge. So I suggest you can shadow a infection control nurse, so you will get more knowledge. So you will become a perfect nurse. So being a perfect will help others to look at you, and they will see you as a role model. The last but not the least practice of great leadership is encourage the heart. Steve, even though you didn't do well today in take care of MRC positive patient, but I have seen you last day. You took all the initiative to save the life of a patient during cardiac arrest. You given the CPR and you saved the life of the patient. So we are going to acknowledge you in front of your fellow workers for your excellence in work. So always remember, you are not alone. Always we will be there to teach you, help you, support you, and we will rock and roll.
Hi, Steve.
Hi Amita, how are you?
I'm good. How are you today?
Yeah, I'm good. Thank you. Thanks for asking.
You're tired.
Yeah, like today was like a bad day, but at the end of the day, it was like had some good lessons from the charge nurse.
Oh, that's great.
Yeah,
What happened?
you know me, like I'm a fresh graduate, so I don't have like any previous experience taking care of like infectious client.
Yeah.
So today I took care of an MRSA client, and I just messed up. I just spoiled everything.
What
So
happened? You messed up using PPE?
yeah, the PPE and stuff.
Okay.
Yeah, and the charge nurse called me, and I was really scared to meet him. But at the end of the day, he just taught me like good lessons. It's really nice.
Yeah, he's very nice actually.
Do you have like any previous experience with him?
Yeah, actually in the beginning when I joined here, even I did lots of mistakes. Just kind of similar mistakes.
Okay.
But the same charge nurse, he is really very kind.
Yeah.
It's very
Yeah,
and
the
he's
word
very supportive to
inspiring. Yeah, he
us.
deserves the word inspiring,
Yeah, he's very supportive to his team members.
Yeah, like he told me the reasons I went wrong. He told me the resources which I can use to just upgrade myself. And finally, he told me that he'll be just posting me in another unit where I have a chance to shadow an infection control nurse,
Okay.
so that I can learn more about infection control practices. Which should, like in future, it will just make myself really
Prepared,
good
yeah.
prepared.
This sounds good.
Yeah. And he's really a good team leader. He
Yeah.
really guided me. He supported me. And in future, like if I was about to become a leader, he'll be truly my role model.
This is really good.
Yeah.
Yes, he is. He is very nice. Actually.
Yeah, I think it's time, Amita.
Okay.
See you again.
See you later.
Bye.
Bye. Hi friends. Did you hear what did he say just now? He said he will take his chances as his role model. Yes. When you're a good leader, people will follow us.